Healthcare revenue doesn't fail in a single dramatic moment. It leaks away in thousands of tiny places. Eligibility checks done too late, codes chosen without the latest payer nuances, claims submitted with avoidable edit conflicts, acknowledgements that stall in inboxes, and remittances posted by hand long after cash hits the bank. The purpose of the LexBilling workflow is to seal those leaks by turning the revenue cycle into a reliable, closed-loop system. Instead of treating billing as a maze of disconnected tasks, it orchestrates a continuous path from visit to cash, using automation for the routine, clear guidance for human judgment, and measurement at every handoff. The need for this approach comes from rising operational pressure. Practices face more rules, fewer experienced billers, and tighter margins. Payer policies change quickly, NCCI edits require precise pairings, modifiers behave differently by specialty, and prior authorizations can derail clean claims before they start. In that environment, manual processes create variability, and variability creates denials. LexBilling addresses this by moving quality upstream. Check eligibility as soon as an appointment is created, structuring counter data the moment it's documented, scrub claims before they leave the building, and track responses and remittances with service-level discipline so problems surface immediately rather than weeks later. From the first touch, the system works to prevent error. Patient and coverage records arrive from the EMR, and an electronic eligibility request runs automatically around the appointment event. The response, plan type, deductibles, copays, in-network status, and prior authorization flags, is cached with an explicit expiration so staff don't have to requery or guess. When the clinician dictates or completes the note, transcription and structured parsing propose ICD-10 diagnoses and CPT-280 CPC services, while a rules engine validates medical necessity hints, place of service, age and gender constraints, payer-specific quirks, and NCCCI combinations. Each claim receives a scrub score with precise explanations and suggested fixes, shifting the team from hunting for issues to resolving the few that matter. Submission is immediate once a claim clears those checks. The platform compiles a standards-compliant 837 and transmits it via clearinghouse connections with idempotency keys to prevent duplicates. Acknowledgements such as 999 and 277 advance the claim status automatically, so staff don't waste time refreshing portals. If a payer response lags beyond the target, timers create a task with the right priority and due date, placing work exactly where it belongs. This is where the discipline of service levels shows its value. No claim quietly ages out of view, and no staff member needs to build private spreadsheets to track what the system should already know. Collections follow the same principle of automation first, review by exception. Electronic remittance advice is ingested, matched to claim lines, and posted with a 1-cent variance guard that prevents reconciliation drift. Payments, adjustments, and patient responsibility flow to the ledger and statement cycle without manual keying. When the numbers don't tie out, the system routes the exception to a queue with an explain panel that shows exactly how allowed amounts and adjustments were derived. Denials are categorized by root cause and accompanied by an appeal draft that assembles the required documentation. Once submitted, outcomes feed back into the rules, so the same issue is less likely to recur. Over time, the platform learns which codes, modifiers, and supporting notes lead to first-pass success for each payer and specialty. These mechanics translate into tangible gains. Clean claim rate rises toward the high 90s because errors are caught before submission, not corrected afterward. First-pass resolution improves, and days sales outstanding compresses by meaningful double digits because the distance between care and cash is shorter and smoother. The cost to collect declines because each claim requires fewer touches and less detective work. Transparency improves across the board. Every read and write of protected health information is logged in an append-only audit trail. Every integration is tracked with status and retry metadata, and every bottleneck is visible in real time. Staff focus shifts from repetitive chores, eligibility phone calls, claim resubmissions, manual posting, to higher value work such as complex appeals and prior authorization exceptions. Clinicians spend less time mediating billing questions and more time with patients. The technology under the hood is deliberately pragmatic. A relational core models patients, encounters, claims, services, diagnoses, payers, remittances, payments, ledgers, denials, tasks, alerts, SLAs, and ED transactions. Integrations with EMRs, clearinghouses, eligibility services, and payment gateways are idempotent and auditable. The rules engine is table-driven so operations teams can tune behavior without deployments, and analytics views expose key performance indicators: clean claim rate, first-pass resolution, denial rate, cash posted month to date, payer response latency, posting latency, and SLA breach counts, so the business can see progress in numbers, not anecdotes. Security and compliance are built in, rather than bolted on, least privilege access, tenant isolation when needed, encryption, and comprehensive audit logging that satisfies HIPAA requirements and makes reviews straightforward. A modern agent capability elevates the experience further by planning and acting across the workflow. It can refresh eligibility for today's appointments, build and scrub claims for encounters marked ready, submit those that meet quality thresholds, follow up on acknowledgements that stall, post remittances that reconcile, and draft appeals when denials arrive, all with approval gates for sensitive actions and transparent explanations for everything else. The agent doesn't replace staff, it eliminates waiting, reduces context switching, and ensures that the system never forgets a next step. In everyday terms, it cuts queue age, raises throughput, and makes the platform feel responsive rather than reactive. User experience matters as much as the back-end plumbing. Instead of burying teams in long tables, the interface organizes work as pipelines and work lists, intake items waiting for eligibility or coding, claims moving from scrubbed to submitted to adjudicated, remittances ready to post, denials approaching appeal deadlines, and integrations with health scores that flag attention. Every card and row is clickable, every alert is actionable, and every explanation is written in plain language. The goal is not just visibility but velocity. Get a skilled user from problem to resolution in as few clicks as possible, with the system pre-filling what it already knows. For practices considering adoption, the path is intentionally low risk. The system starts in advisory mode, observing and suggesting without making changes. Next, it automates safe wins, cached eligibility, scrub scoring, and task creation. Submission and acknowledgement tracking come online once confidence is high, followed by collections and appeals with explicit approvals. Throughout, performance tuning and partitioning maintain sub-second dashboards even as data grows, and background jobs handle retries with backoff so transient integration hiccups don't become human fire drills. The economic story follows naturally. A small clinic handling a few thousand claims a month can reclaim meaningful sums by preventing denials and accelerating cash. If eligibility pre-checks eliminate even a fraction of same-day rejections, if scrubbed claims raise first-pass resolution, and if error posting becomes push-button reliable, cash stabilizes while headcount stays flat. Multiply those gains across specialties and payer mixes, and the compounding effect becomes clear. Less working capital locked in receivables, fewer write-offs, and a quieter back office that spends time solving exceptions rather than managing chaos. What sets this approach apart is not a single feature, but the coherence of the whole. Eligibility happens when it should, not when someone remembers. Coding suggestions arrive with rationale, not mystery. Submission is idempotent and traceable. Tracking is SLA-driven. Posting is mathematically disciplined. And appeals close the loop with learning. The platform doesn't promise perfection. It builds a system that makes the right behavior the default, and the wrong behavior hard to sustain. In a landscape where administrative burden and payment complexity continue to rise, that combination of automation, guidance, and proof is exactly what turns billing from a reluctant chore into a dependable engine.